Welcome everybody to today's webinar. October is Mental Health Awareness Month, so that's what we're going to be talking about today, how we can better support our own mental health and the mental health of those around us. My name is Kate, I'm the Community Engagement and Events Coordinator here at IMRI. I'd like to acknowledge the Dharawal people, the traditional custodians of the land on which IMRI sits. I'd also like to pay my respects to elders past, present and emerging, and extend that respect to Aboriginal people present on the webinar today. So, we know the COVID pandemic has had a real impact on our health, on our social connectedness, of course, economic and employment situations, not to mention various challenges of, for example, working from home combined with homeschooling. And the pandemic has been particularly detrimental to the mental health of one of our most vulnerable groups, our young people. And today's webinar will cover what we can do to support everybody around us, but also what we actually mean by mental health, what causes mental illness, and what we can do to support those around us. The Illawarra Steelers are committed to supporting mental health in our community, and IMRI is incredibly grateful to the Steelers for supporting the delivery of this webinar and research into mental health at IMRI. And I would like to invite Graham Gullett, the Steelers chairman, to just say a few words. Over to you, Graham.
Thank you, Kate, and thank you for the opportunity, and good afternoon, everyone. Today's not really about the Steelers, it's about the fantastic work that IMRI's doing, and it's a great asset for our region, and we're absolutely delighted that we're able to support this program. We have a community sport program that we support in rugby league, and we have done for many years, and of course our communities have been impacted by the pandemic and the ability for people to get out and spend time together. We're in a really fortunate position at the Steelers to support programs and projects, and since I took over the chair 3 years ago, we asked our team, our staff and our members where they'd like to direct that support, and we've been able to support One Door Mental Health and Dan and his team in the delivery of a program across our rugby league clubs, and now we're absolutely delighted to support IMRI. So wish you all well today. I hope the webinar is a success, and continued good fortune with the work that you're doing. Thank you.
Fantastic. Thank you so much, Graham, and thank you for all the work that you're doing in the community in this space. We really do appreciate everything that Steelers is doing, so thank you. All right, we're going to just say goodbye to Graham. I can work out how to do this. I'm just going to stop your video, Graham, and then we'll work out how to drop you off. Okay, thanks again, Graham. Oh, there we are. Okay. All right, so today for our webinar, our panelists, who you can see there, is made up of Professor Lorna Moxham. Lorna is a mother of 2 girls, a grandmother, a wife and a carer for her 90-year-old mum who lives with her. She's also lives happily with a menagerie of animals. She's been nursing for 41.5 years, 39 of which have been specialising in mental health. Lorna works as the Professor of Mental Health Nursing at UOW and is the co-founder and director of Recovery Camp, which I know we'll hear a little bit about later on. It's a social enterprise that's a positive psychosocial intervention for people with mental illness and a clinical placement for health professionals. Welcome, Lorna. We also have Dan Hunt from the mental health movement. Welcome, Dan. Dan had an impressive sporting career, and during his career as a professional athlete, he struggled with and overcame many adversities. His own life experiences and determination to help others is what inspired the creation of the mental health movement and led to Dan's further study in mental health, community services, mental health first aid, alcohol and other drugs, fitness, business and career development. And we also have ISLID's clinical psychologist, Billy Fogden. Welcome, Billy. Billy is a clinical psychologist working primarily with young people in the Illawarra area. He has worked with children and adolescents for over 10 years across a range of complex mental health presentations within the private and the public sector. and Billy has a specific interest in parenting and the role that family members play in recovery. So thank you so much to all of our panelists for being here today. And to our audience, our panelists want to hear from you today. We're very much encouraging you to pose any questions that you might have for any of our panelists in the Q&A function, which you'll find just at the bottom of the screen. So please make use of that. We'll be doing questions throughout the webinar and have a dedicated time at the end as well to answer questions. And we also encourage you to share any personal experiences or any comments that you'd like to make in the chat function, which can also be found at the bottom of the screen there. A recording of today's webinar will be available, and I'll send that link around along with any useful resources that might come up during the webinar to everyone who is registered. And finally, for those of you who don't know, the Illawarra Health and Medical Research Institute, better known as IMRI, is a not-for-profit charity that supports health and medical researchers in the Illawarra Shoalhaven region. We bring scientists, doctors and health professionals together to solve our greatest health challenges through research. And our scientists are working hard to find better ways to prevent and treat diseases such as cancer, diabetes, mental illness and dementia, to name just a few. If you are curious to see the other areas of research that we do, head on to our website, which is www.imri.org.au. But for now, let's get on to the webinar. And I thought I would start today's webinar with a poll. Let's see. Yep, with a poll. So around the percentage of our Australian population who experience a mental illness each year. So I'll just launch that poll. Hopefully everyone can see the poll. We would love to know what you think. What percentage of the Australian population experiences a mental illness each year? Is it 5%, 10%, 15% or 20%? Let's give you a few minutes to answer that poll. Okay, let's end that poll. And there's the results. So we've got 73% of you think it's 20%. I'm going to hand over to Billy just to talk us through those results, whether we're right, and to talk a little bit more about what causes poor mental health. Over to you, Billy.
Thanks, Kate, and it's a privilege to be able to talk on the panel today. So thank you for having me. Look, everyone's pretty spot on. About 20% of Australians will experience a mental health issue across the year. And it's something which probably over the last 10 years or so is gaining like a lot of prominence, a lot more awareness around it too, especially with younger people. So in terms of mental health, often it is, you know, people talk good mental health or poor mental health. And sometimes it is sort of measured across the spectrum. I know, Dan, with your mental health continuum, it talks about mentally healthy to sort of mental illness. And I guess mental health isn't just an absence of mental illness, just like physical health isn't just an absence of physical illness. So I guess people talk about maybe what isn't good mental health. And I think some of the causes of, especially with COVID, there's been a lot of impacts on mental health in terms of isolation, in terms of loss of identity, loss of work, and I guess a lot of prevailing stresses in relation to a lot of social disconnect as well. But in general, a lot of what is said around the causes of poor mental health is really around, I guess, disconnection, loss of identity, detachment from community, financial stress as well, grief and loss as well is a major issue. But there's also an understanding that there is a genetic component and there is an environmental component to it as well. And so often there is a genetic link for disorders, and also there tends to be an environmental. So with some disorders in particular, the stress in the environment can often trigger a mental health issue as well. And I guess an important thing that we often look like working for the mental health service is what the difference is between positive mental health and also what mental illness is. And sometimes I reflect on that in terms of when does it become an actual issue. And a lot of that has to do with the level of impact it has on our daily functioning, and the level of dysfunction it has as well. So often with work, like reduced work performance, motivation, maybe difficulties engaging with friends or school. And then sometimes if it has that level of dysfunction, it can be considered more of a mental illness or an issue. Whereas on the other end of the spectrum, there is a mental health focus. We've got to keep it sort of positive. We've got to keep it actually tending to our mental health, because it tends to be situation specific and potentially state dependent. So across time it can vary, whereas with a mental illness, it can sometimes be pervasive across different contexts and things like that.
Thanks for that, Billy.
Thank you.
Lorna, Dan, is there anything you'd like to add to that, talking about mental health or our mental illness in general? Or we've covered everything.
Mute got another victim then. So look, it's very awesome and very well articulated, Billy. And I think the part of it is as well, you can be diagnosed or live with a mental illness and also be mentally healthy and flourishing as well. So I think that, again, when we talk about that in and around the stigma, which a mental illness, and when I do share parts of my own story, like what Billy said, it's not it's a process. It's whether you're managing yourself or your mental health, or managing a mental illness or a mental health struggle. It is that process where there is no finish line to it. And I think the understanding that we don't have to do any of that on our own is a big part of it. So that's probably the only bit that I wanted to add. I thought it was well articulated.
Great, thanks for that addition, Dan. Well, Dan, I wonder then now, would you be happy to share your experience with our audience and what brings you here to be part of this webinar today?
Yeah, look, and thanks. And it's a privilege to be on a webinar with Lorna, Billy, and yourself. I have done a little bit of stuff with Lorna many years ago. But look, I think the part of why I wanted myself and MHM to be part of this is obviously the goal in and around Mental Health Month, which is tune into your mental health, which is awareness, but education. But how is that applicable to yourself? And how can that change your own perception to the way in which you view mental health, mental illness, and the way you interact with that with yourself and the people around you? But what I've seen from sort of finishing my social work studies and transitioning out of professional sport and working in the mental health space now for probably the last 5 years is that the part that I guess we do need to remove, and we have done such a good job of it, is that stigma. But we've got to cut through and connect with people. And one of the things that I've seen that really does connect, that assists the literature, the best practice, the training, the resources, all the elements that need to happen, whether it's in the workplace, whether it's with an individual, with a family, friendship circles, is that power of story and lived experience. Because one thing that I know, Australians, or everyone, they have their own story. And stories, we've been through our own changes, challenges, and adversities. It shapes who we are. It shapes how we see and interact with the world. So part of what today is to try and connect with the audience and let them, I guess, give them some insight into what it potentially is like managing or living with a mental illness, but just some of the barriers that I faced and some of the things that I now put in place to help myself with that. So obviously, as Billy said, there's some genetical factors which I found out. There is a mental illness gene within our family, which obviously that doesn't mean you're necessarily going to be diagnosed with a mental illness, but it does put you at higher risk, which I found out when I was diagnosed in November of 2010. But my environment in which I grew up was around domestic violence, physical violence, trauma. There was sort of drugs and alcohol, and these elements, as you know, kids are a product of their environment, and that put me at higher risk, which I didn't know at the time, but I was taught to get on with it, get over and harden up. And that's exactly what I did. I just swept it under the carpet, pretended like it wasn't there. And I definitely didn't put my hand up, talk about it, seek support. And as a young kid, as a young adolescent, I was very up and down, very disengaged, getting quite in trouble at school a lot. And three things from now being educated in the space that I lacked was that identity, purpose, and belonging. And I just suffered in silence for a very long period of my life. I was lucky, though, that I did have sport, which was in rugby league, which it sort of helped me break the cycle in which I was growing up, helped me get back on that straight and narrow. But it gave me that sense of identity, purpose, and belonging. I was around more positive people, started to see more positive things, and started to do more positive things. And it did serve me really well. I was lucky enough to play 10 years in the NRL with the St. George Illawarra Dragons, but in that environment, it was very high pressure. There was a lot of stigma. It was trying to earn your stripes. And I thought I had to be this big, tough tough man. So I again, one of the things that I developed was the brave face or the mask. And some days I'd come in and I'd perform well, as Billy said. I'd play well. I'd be a bit of the joker, and things were okay. But other days I'd come in, I could hardly have a conversation with someone. I'd be withdrawn. My relationships would be struggling. I'd be down, my moods, and I just had no understanding of what was going on. I wasn't educated in the space, so one of my coping strategies was sort of isolation, was disconnection, was wearing that mask and pretending, or what's the word, probably trying to convince myself and everyone else that I was okay. Because I was worried what people would think about me, what they'd say about me, whether I'd get picked in the side or not, how I'd be treated. So I just kept it to myself. Look,
that's been exhausting, Dan.
Yeah, it was, and the cracks did start to show, but it was, I used the saying, it was like there was a war inside my head. And it just drained you both emotionally, physically, and it changed you behaviorally as well. And then it was, in 2010, and that's the thing, you can't force someone to seek support unless they're in crisis. You can't force someone. They need to go through their own experience, their own life event that gets them to that point. And for myself, it did come crashing down for me in 2010, where I had a season-ending injury. And look, the way in which I dealt with that was the way in which I seen my father deal with a lot of his challenges. And I turned to isolation and anger and self-medication through drugs and alcohol. And it put me on a very slippery slope and put me in the darkest place I'd ever been in. I was trying to numb the pain I was in, trying to escape reality, which in the end, to the point where I almost didn't end up here. So from there, it was about having the support networks around me that didn't give up on me. And I had that through my partner, who's my wife now, my mum, and Wayne Bennett was my coach at the time, who I'm still very close with. But they got me to realize that it was okay to struggle. It's part of the human experience, going through a struggle. But part of being resilient is going through a struggle, and you're not alone. But the other part of it is it's also okay to seek support. And through some conversations, some check-ins over a period of time, I was able to, I guess, change or reframe the way I was looking at myself, my conditioning, my upbringing. And I did go and seek that support through the Black Dog Institute in Randwick in Sydney. And without going into too much detail, I was diagnosed with a mental illness in November of 2010 in type 2 bipolar disorder. And look, for myself, I honestly, other than having my kids and meeting my wife, it is the best thing that's ever happened to me. And the reason why is it drew a line in the sand for me. It started me on my mental health journey. You read this, the textbooks, it's one in two or in their lifetime will experience a mental illness, suffer with a mental illness, or as we said there, 1 in 5 will suffer with a mental illness in any 12-month period, where I really think language is very powerful, and people do suffer. I 100% understand that, but I like to say I've learned to manage a mental illness rather than suffer with it. And that's where I try and empower, get people's hands back on the steering wheel, because I had to go through that journey. I spent time in a mental health clinic, a drug and alcohol rehabilitation program for 12 weeks. And you had to confront a lot of elements where, for myself, it wasn't so much the substance, it was the reasons behind why I was using the substance. So I had to process, I had to unpack through interpersonal therapy, schema therapy, a range of different cognitive behavioral therapy treatments with mental health professionals, with them in group. And that period helped me understand I had to take accountability and responsibility. I had to be open and honest. I had to be vulnerable. And from there, it just helped me lay a foundation to transition back into, let's say, everyday life, and have the resilience, the supports, the coping strategies. And from there, I got back to playing footy, played 10 years. Obviously, it didn't end the way I wanted to with injuries. But during that period, I was able to go and study and put not just the lived experience, but the qualifications together to try and make a change, or I guess add value to what the space was already trying to achieve. And I honestly find more identity, purpose and belonging in what I do now in the mental health space with MHM and the people we work with than I ever did playing in the NRL. But I think for it all that's helped me is education has been the key to all of this, because we don't know what we don't know. And for me, it was easy to plead ignorance. It was easy to sort of bury my head in the sand or justify things to myself. Like, I'd lie to the support networks around me to help justify things, where how was I supposed to get the right support if I wasn't being open and honest? So from there, again, education, but self-awareness, being able to check in with yourself quite regularly, and I guess shift the expectation that we've always got to have our shit figured out. We've always got to be perfect. We've always got to be smooth sailing, where it's an expectation that we put on ourselves that just isn't achievable, where it is the ebbs and flows, the ups and downs, the sliding up and down of the continuum, and knowing that I've got the supports and using them, and it's something that's really, really helped me. And I think the other part of it as well is I'd wait till shit hits the fan. I'd wait till I'd hit rock bottom before I'd take action, where research, it's crystal clear that early intervention leads to better outcomes. So if I notice myself sliding down the continuum, I have controls in place. I have the supports, the self-care, the coping strategies. And that's what we try and educate and put across to as many people as possible. We're not here to stop people struggling, because that's part of life. We're here to help people be able to be better supported, be able to better cope with the struggle, and provide them hope through the struggle, to get their hands on the steering with that empowerment over that disempowerment. But I guess, yeah, I just want people to know that you're not alone in the struggle, in particular with what we've been through in the last 2 years. And if you can't see the light at the end of the tunnel at the moment, there is light. It's just about finding someone to help you see that light. So.
Dan, thank you so much for sharing your experience, and it's wonderful to hear that you had that support, that you were able to find the support that you needed at the time that you needed it. And there are some comments coming through around, well, how do I get support? Where do I find this support? And we absolutely will touch on that in detail at a later stage during the webinar. But I just want to ask you, Dan, you mentioned around the stigma of mental health, and that you felt the need to just put a mask on, put a brave face on, and just carry on as normal. How, as a community and a society, and this is a question to all our panelists, how do we go about beginning to remove that stigma of mental illness? What do you think the first steps are? And do you think that it's already underway?
Well, I can speak from when my journey started in November. Obviously, I've been living and managing it my whole life, but the awareness of it from November 2010 to where we are now, and I've spoke to just over 350,000 Australian workers from 150 different companies, where we have come a very, very long way. 100% we have. And Lorna, you could probably speak to this as well, where I still feel where it used to be the get on with it, get over and harden up was the majority, where that I feel is now the minority. But it's still just a lot of expectation has been put on the person going through the struggle, that they've got to speak up, that they've got to, but when you're in that struggle and your blinkers are on, you are focused in that struggle and you're in that dark place. How are you supposed to explain something to someone else when you don't understand it yourself? So it's also about educating people around, like, the support networks of how to best hold those conversations, start those conversations, understand their role and responsibility. It's not to fix, solve, or diagnose, it's to facilitate. I think that's really important, and that can go a really long way. The other part is people still think that mental health doesn't affect them because they associate mental health as mental illness. So probably the most fundamental fact is understanding if you've got a brain in your head, you have a mental health, and the better you look after it, the better you look after yourself.
I can remember when I started my training in 1980 and picking up on what Dan said about people not talking about it that night. I can remember being trained and we were told, oh, it's all in the head. Of course it's in your head. As Dan said, it's mental health. It's in your head. It's very real. And I agree with Dan again, and Billy, and I know Kate. Stigma, we have come a long way and we've got a long way to go. Language is really important. And I do what seems like simple things, but they're not really. If someone tries to tell me a joke about someone with mental illness or a mental health issue, I just say, look, I'm not, it's like racism jokes. I'm not really interested in hearing them. So I pull people up. When people use derogatory terms around mental health and mental illness, changing that kind of language is really helpful. But again, I think the biggest thing we can do to tackle stigma is to keep talking about it. We never used to, and now we know we need to talk about it. We need to raise the awareness. So that talking is really vital.
Mm. And oh, sorry, Billy.
I was just going to add, yeah, I think even over the last 5 to 10 years, you have seen a lot of change with people coming, especially in the adolescence and early 20s. I've noticed a bunch of people come through that are now feeling much more able to speak about it. The probably challenge I've noticed in where I work is getting the males into the service. I think it's about 80-20 at the moment in terms of who we see from females to males. So getting, like you're saying, Dan, I think that was really good, but getting them to be able to talk about these sort of things and realize that there is support out there.
So raising awareness around the
yeah
space.
Yeah, and I think it is getting better, but as you say, Lorna, it's still a little bit to go, I think, definitely.
And Dan, as well, when you were sharing your experience, you mentioned about self-reflection. There's a great question here from Emily, who says, what do you think is a good method of reflection to raise self-awareness? Not everybody is self-aware. So what can people do, again, to all our panelists, what can people do to raise their own level of self-awareness, to know that they need to seek help?
Yeah, I think the mental health continuum behind me is something that we developed to help people with exactly that. Like, if it's the first step is understanding the difference between mental health and mental illness, as Billy alluded to, but it's also, okay, physical health, we can jump on a set of scales, we can get our blood pressure done, we can get an MRI. Well, that gives us an indication around physical health. So regarding our mental health or mental health struggle, there's obviously the diagnostic tools, but that's not what this is about. This isn't diagnosis, this is self-awareness. So that's why we use the continuum. You've got the green, the healthy, the yellow, the sliding, orange, struggling, red, and ill. We all have a mental health. We move up and down it every second, minute, hour of every day. So on the top is kind of those signs and symptoms, or the indicators that we can identify in ourselves and others. And on the bottom is the actions we take, depending on where we are on that continuum. So we obviously will provide this resource to everyone, but I use this pretty much every single day. Where am I on the continuum today? I check in with myself before I check in with the world. And then depending on where you are, you get that self-awareness. Okay, I might need to change the way my expectations on myself today. I might need to seek some support today. I might need to put some extra self-care in. I might need to take some time out. I might need to seek my supports. Look, have I taken my medication? Am I getting enough sleep, my nutrition? Am I putting all these things in place? And if I'm not, well, it might just be a little bit of a recalibration, or get back to the supports and things like that. But I think just having something tangible to check in helps, because obviously you can't see it. Someone's had their arm cut off, you can see that. But someone going through a mental health struggle, someone that's living with clinical depression, looks very much like someone that could be flourishing. And that's probably one of the challenges in and around the stigma, but making it tangible can make a world of difference.
Yeah, thanks, Dan. I hope that answers your question, Emily. And Dan, are you happy to share the mental health continuum? So I'll pop that in the follow-up email, along with the other resources that we collect during the course of the webinar.
Kate, can I add to that? Sorry.
Sure.
But,
yeah.
One of the things that the difficulties is, it's a bit like a jigsaw puzzle, isn't it? Let's just say we're made up of 100 pieces in a jigsaw puzzle. Becoming self-aware is really difficult, because we've got to put all those pieces together. So learning to become self-aware, one of the things that may be helpful is keeping a journal. And it's quite a simple thing, but it's a very powerful thing. So just writing down, I don't feel good today, and writing down what's going on. Haven't had breakfast, haven't connected with anyone. And then you can start to see, after a little while, some people do it really quickly, some people it takes a little bit longer, but journaling helps us put those jigsaw pieces together and understand trends and patterns at which we can then associate with our feelings. So that's a helpful strategy.
Great trick.
And just to add to that really quick, sometimes I'll get people to just, what do I need right now? And it might be something really minor. It could be something, a self-care activity, but just getting a bit of on the pulse a little bit with what's happening in terms of their mindset, what they're feeling physiologically, what their body sort of needs at that point in time, is a useful sort of center point to come back to.
So rather than trying to deal with everything all at once, which can be wholly overwhelming and you just don't even want to get started, just think about that one thing that you can do today that will improve things. Is that right, Billy?
Yeah, definitely. It's just kind of tuning into your mental health and knowing, okay, what do I need right now? Is it a good conversation with a friend? Is it something exercise that's going down to the beach? Is it calling my counselor, for instance? It's just kind of learning to check in, like you're saying, Dan, with what's happening with yourself.
Great. We're going to move along a little bit, because we've said already, you know, we're going in the right direction in terms of removing the stigma of mental illness. And I know there's an awful lot of research happening in this space, not just at IMRI, but at medical research institutes all across the country. Lorna, I wonder whether you could just talk us through a little bit about some of the research that that you've been doing in your career in terms of mental health management and improving outcomes?
Thanks, Kate. Everyone's probably really scared that I'm going to jump on and do a death by PowerPoint research presentation, and I can assure you that I'm not. There's a lot of research happening in our local area. There's a lot of research happening, but there's a lot of research happening in our local area. And I'm not going to start naming people, but obviously the programs that Dan's running, what's happening in Billy's space, sport and exercise. There's a really large mental health program called Ahead of the Game, and Dan's already alluded to the notion of sport and exercise is about connectedness again, but there's a lot of research around the beneficial effects of sports and exercise. Emory has a whole section, a whole program, mental health and the aging brain, which we have a lot of people doing neurological research, quality of life research, all sorts of research to find out better ways to deal with and manage, right from bench science, medications, right through to quality of life and programs. Research around intergenerational trauma. We know certainly our First Nations people have been affected by intergenerational trauma, but also people that have come to Australia as refugees, seeking asylum, and that live with intergenerational trauma. So we know that someone today can feel the effects of trauma from granddad or grandma or intergenerations. And then, of course, at the University of Wollongong, we've got the Northfields Clinic that does a lot of research and also trains our PhD students when they're on their trajectory to become clinical psychologists in their doctoral programs. So there's a truckload of research around. The kind of research that I do is, I like to think it's very pragmatic. It's really about, it's not about cure, it's about helping people become empowered, helping people have a better quality of life, living the journey. Again, I want to reiterate what Dan and Billy have said, that mental illness isn't either or none. It's a journey. Someone's put up in the chat that, you know, you're not going to get on a mental health plan and get cured in 12 months. It's most people live with it as an ongoing journey, and it's about managing it. So that's the kind of research that I do. And you alluded to when I began, and thank you, Kate, and I've worked with Dan on this some time ago, but we run a camp now called Recovery Camp. So it's an immersive thing. It's a number of things. It's a psychosocial enterprise. It's a clinical placement, and it's got a full-blown empirical research program built around it. So we take people who have mental health issues, who are living in the community, over 18, away for a week. And we go to the Australian bush. We know nature is curing. We know nature is restorative. So we've deliberately chosen the Australian bush. And we immerse people with mental health issues with future health students, mostly nursing students at the moment, but all sorts of health students. And health students learn from experts by experience. So I can give them my textbooks and I can give them all of those things. I put someone with a lived experience in front of them. I put Dan in front of them to talk about his lived experience, and health professionals learn. And that's what we want to do. We want to change the mindset of that clinical, hardcore clinical mindset. Yes, it's important to understand it, but to also understand that lived experience. So when people share their stories at camp, it's very empowering. Our research has shown us that if you attend recovery camp, you're likely to have a 67% reduction in admissions to ED. And if you do have an admission to hospital, you're likely to have a 38% reduction in length of stay. And that's not because of anything other than being empowered. And again, it's what Dan's talking about, empowering people to manage, find their own strategies, to build self-awareness, and to have a sense of purpose. And at recovery camp, the sense of purpose for people with mental illness is to teach those nursing students how to be the best registered nurses that they can be. We have sessions called "What Does a Good Mental Health Clinician Look Like?" And people with lived experience tell us what it doesn't look like, but what it does. So those kinds of things are really empowering for people with mental health issues, and really empowering for people that are learning to be clinicians. Because the days of clinicians knew all and clinicians knew best. Clinicians know lots of things. Absolutely they do. And this isn't about putting clinicians down, but it's a shared journey, and sharing that knowledge and that understanding and that empowerment with people who have a lived experience is the way forward. So there's lots of research. I'll stop here because I could go on, but we live in a fortunate area where there's a lot of research happening.
And I'll make
what you said there, it's the best practice research, the clinical validation, all those elements, with the doing it in a way that does connect and cuts through, like that formula, what you've done there, and well done to you. That's just magical. That's I won't say the answer because there is no answer, but it's the blueprint in a way.
Thanks, Dan. It's part of the answer. There's many parts and we're part. Yeah.
A great program. And I imagine through over the last 18 months, unfortunately, it's most likely been impacted by COVID-19, as many of our services have, unfortunately. Billy, I might just jump to you, if I may, to just talk us through what you've seen in the last 18 months or so as a result of, say, social isolation and the impact that's had on our mental health as a result of COVID-19.
Yeah, as could probably understood, it's been huge. My role sort of is working as a psychologist for young people as part of New South Wales health system, and pretty much COVID's been the combination of all the worst factors to contribute to your mental health, and one of those big ones is the social isolation, and probably commenting a little bit on children and adolescents mainly, but the transition to homeschooling has been massive, and it has been somewhat positive for some, but the large majority has been really negative because it's actually taking away from your community supports. Like Daniel was saying, that the sense of community and purpose that comes with playing sport, for instance, is huge, and actually losing that for young people and being confined to maybe home environment where sport actually allows them to get out of that home environment and to build that sense of resilience. So when the COVID started, the lockdown, we really panicked, going, how are you going to help kids and adolescents to actually manage their mental health? And look, that's been reflected in the number of referrals we're getting. It is so hard to access a mental health referral at the moment, whether it's in the private or the public sector. I think just looking at the stats from last year, we've had a 50% increase on an already stressed public health system. And then I know even people trying to get private referrals at the moment is really difficult. There has been one change. I think the government now has doubled the length of the mental health treatment plan from 10 to 20 sessions, but it's still relatively insufficient at times, and the wait lists are often 3 to 6 months or so. But I think just for young people in particular, this is probably generalizable to sort of the wider population, but there's been, the amount of people told me that the Groundhog Day is just happening every single day. There's a real lack of variety in what they're doing. There's a real inability to for people to commit to their values and sort of join in what's important in their life. Then there's obviously a lot of uncertainty, and especially with this sort of postponed lockdowns all the time, was a level of when this is going to end, and this kind of numbness to it all in a sense. And that was really impacting a lot of people's mental health, and getting people where they were starting to isolate. They couldn't access their support services, or if they were, it was through online services, which had been good to some extent to access some of the hard to access populations, but at times maybe wasn't the same as a person-to-person contact. And the other thing is around people relied on maybe quick fixes, so whether binge eating or using substances, or even online shopping, gambling. So they would kind of resort to sort of short, sharp sort of dopamine hits, which in the long run can be not so good on your mental health as well. So definitely with young people, it has been a massive change, but there also has been some positive elements to it as well. People have found that they are connecting perhaps a lot more actually, and checking in with their mates, calling them, organising Zooms and sort of things. So we have noticed that the young people in particular have adapted to the social isolation. I was reading a report by Headspace the other day around that their sort of empathy for other people has been increased as well, and they have kind of understood people going through a similar struggle. So I'm not sure if that actually impacts on the mental health stigma, and whether, you know, people are talking about mental health more, about how much COVID has impacted their mental health, and hopefully that's actually creating avenues to access and check in on people and talk to family about what's going on. So similar to Dan, so you're not just suffering in silence.
Yeah, thanks so much for that, Billy. Actually, I just had a great question, which I think it might be the right time to ask, from Amy, referring to adolescents. How do teachers of adolescents empower the students to be able to assess their own mental health? Is that something you might be able to answer?
Sorry, can you repeat that?
Sure. How do teachers of adolescents empower students to be able to assess their own mental health?
Yeah, look, I think the education system and teachers in particular are often the first port of contact. The teachers have a really sort of, they got their finger on the pulse of a lot of their students a lot of the time, and they often can be the first one to say, hey, you know, what's going on? I've noticed you being flat. I noticed that you haven't been handing in your assignments, or you haven't been doing your Zoom calls, and that can often be that first conversation to a bit of a chat about mental health. I think as a general thing, even as teachers talking about it, I know probably 10, 15 years ago, it wasn't as mentioned as much. And now it is a pretty common thing amongst schools to talk about it. I know that we run mental health programs in schools as well. So in terms of what teachers can do, I think one of the major things is normalizing and talking about it, and checking in on the students as well. And then if possible, referring to your school counsellor, or referring your GP for sort of mental health treatment plan. But again, I think the best thing is trying to increase access.
Great.
I hope that answers your question.
Lorna, Dan, is there anything you'd like to add to that on how you've witnessed COVID-19 having an impact on our young people or any areas of community?
I think looking at it, it's kind of in particular young people, but human beings are we go through these what we call contributing factors or changes, challenges, adversities, like finances, relationships, kids, early life experiences, trauma, self-medication, physical. And it's the range of things that we all go through at different times, where that slides us up and down this continuum. But with COVID, it's added a whole nother layer of stress, worry, fear, uncertainty. The goalposts keep getting moved, the 11 o'clock updates, the lack of connection, all this added pressure. So someone that might have spent most of their time here might be spending a lot of their time down here. And if you've kind of never been down there or experienced that, it can be very scary and confronting. So we are seeing a lot more people with those added pressures and expectations and fears and worries and uncertainty and elements like that. And it's kind of put this, well, we can only speak for Australia, but put the Australian population into a bit of a stress response, where like that elastic band's been stretched, but the elements that we usually put in place to get our baseline back or to slide back up this continuum, like going to the gym or traveling or holidays or connecting with people, family, we haven't been able to do those things. So the scales are kind of what we've seen have been out of balance. And it has taken a period of time for people to kind of acknowledge that, identify that, and then recalibrate, where we've had to learn to do things a little bit differently to get similar outcomes. And we've definitely seen that across a lot of the people we've been able to work with, where even just having that self-awareness or helping them through that recalibration, where they're able to put different things in place, but to get those sort of basic human needs that need to be met around self-care, around connection, around those different elements that support as well, that can make a world of difference. But that's definitely something we're seeing as well. The stigma is being removed. People are becoming more aware, but a byproduct of that is more people are seeking support. We're improving help-seeking behaviours. So that's hence we're seeing the overwhelm of those support networks. So it is just going to be probably a process of evolution, organic evolution, where we develop more of the support networks to facilitate the sort of from the proactive end to the reactive end. And it's just a collaborative effort. But yeah, they're probably some of the things that we've seen that are happening.
One of the things that I think is really important too, and I love the analogy about scales, because it's almost now it's like, oh, we're going to be back to normal and the scales have completely recalibrated. And I can only speak for me. The scales for me are going to come up like this slowly. It's not an instant back to recalibration, back to normal. I'm nervous about reopening. I'm nervous. You know, I've lived this cloistered, unknowing life for many, many weeks now. So getting back to normal, I mean, it's the new normal. It's that recalibration can be slow. So not expecting everything, those scales to be dead even straight away, and taking it slowly and reconnecting slowly. And those things are really important.
Yeah. I'm just aware of the time, and I just want to make sure we touch on services and treatment options that are available. So if somebody is feeling isolated, or they're feeling nervous about getting back to normal, what can people do? Where's their first port of call if they're feeling anxious, or they think they might be depressed, or they're worried? What should people do? What's the first thing they should do? Who wants to take that one?
Look, I'm happy to. Look, first and foremost, I think if available and if safe, is talking to family and friends. Even sharing that information and your struggle can have a really healing effect on it. So I think for a lot of people, that is your first port of call. And I think following that, it is, like Dan's continuum, which I think is really good, is starting to check in and say, okay, this is a really pervasive thing. This is enduring across contexts. It's really starting to impact my relationships and my work performance, school application. And that's where you can get in touch with your GP. Your GP will write you what's called a mental health treatment plan, and you can access Medicare subsidized psychological sessions if you felt like you needed that professional help. But I think a lot of mental health support is through your close supports who understand you, who get you, and also your community groups. And that's why I'm so excited that the lockdown's ended, because it's allowed people to hopefully re-access community groups, whether it's your creative arts group, whether it's your hiking, your bird watching group, or your sports team. It's so important that I think that's probably my first protocol. And then if therapy or counselling is actually needed, then it can be of use to check in with your GP.
I think adding to that as well, there's a comment there just with some of the actions with the continuum, where they're obviously seeking that support and putting things in place around best practice. But adding to what Billy's saying there is in and around that self-care. We call them kind of the 5 percenters, where you might think, gratitude, or getting out and getting some sunlight, or getting in the salt water, or going for a walk, or fresh air. Look, those things, they're not going to solve the world's problems. Okay, I understand that, but they are going to make you feel that 5, 10, 15% better to then take on those world's problems, or be able to have that confidence to get those hands back on the steering wheel. So self-care is also something, because it helps give us the best chance. And I understand when we're in different headspaces and different ends of the continuum, that can be challenging. I think as well, with when we do open up to family, friends, or fellow workers, or community members, whoever it may be, it's just really important to make sure that we're connecting with the right people, because I've had people in my life where you go in there to help you slide back up the continuum, and they actually slide you further down. So you want to just make sure that you've got people that are empathetic, that actually care, that aren't there to, you got nothing to worry about, and just dismiss your struggles. You want people that acknowledge your struggles, that are there to listen, that don't try and fix and solve, but just really listen to what you're saying, and then support you into other support. So just making sure that profile of a good support, which we can send through some resources after this as well, but just making sure that we've got the right people in our support network to help us as well.
Can I add to that? Because those 5% all add up, don't they?
They do.
5% doing gardening, 5% going to dog training, 5% whatever, they actually do add up. And obviously put in the 5% of the professional help if you feel that you need that and you want that and you don't feel safe. And of course there are emergency departments, but we have non-government organisations, the Flourishes, the Nemais, the Clubhouses, the Wonderfuls of
Arachnes,
and then Arachne. And then, of course, in the Illawarra, we're very lucky to have, it's called Safe Haven, and it's auspiced by Stride, which is a non-government mental health organisation, and it's for people with suicidality. So it's a house you can go to if you're feeling suicidal, if you're having thoughts of self-harm, and there are a lot of peers in there, people with lived experience that can help you feel safe and work through those issues. So there's the clinical supports, and then there's the peer supports, but all of those 5% absolutely add up.
Yeah. And add to that, just in and around sort of crisis, but in particular in and around suicide, if we're having those suicidal thoughts or the plan, like we don't keep that a secret, and you're not alone in any of that. But yeah, we don't keep that a secret. It is about sort of ringing, your Lifeline, you got 13, 11, 14, your suicide callback service, 000, your CAT teams, your crisis assessment treatment team, the safe haven there. I just really want to reinforce that you're not alone in having those thoughts and things like that. And the supports are there. But we don't want to keep that a secret, and I've been there. And if we don't keep it a secret, we can get that support that we need in that period of time, because it's not an illness, suicide. It's a behaviour. So if we can get that support and know that you're not alone in that, look, that's going to be saving and changing people's lives as well.
I'm going to just go to some of the questions. So this is an interesting one from Kyla. Kyla wants to know what you think. Would it be beneficial to implement social skills training at schools to help reintegration and reduce social anxiety? And has any research been done on developmental effects of lockdown? So perhaps the first part of that question around implementing social skill training at schools to help the students. Any thoughts on that one?
I think that's a great idea, but again, we're asking our teachers to do a lot of extra things that they might not necessarily have the skills about. Teachers in this lockdown and everyone homeschooling, we've all come to absolutely appreciate the worth of teachers. But again, it's taking that slowly, isn't it? The scales are instantly back in balance. We've got to relearn how to talk to one another, how to connect, how to share our sandwiches. I'm not sure if you're allowed to do that at school anymore, but those kinds of social interactions that it's going to take time to learn to do that. So being patient with people, not expecting people to reopen and the scales to be absolutely on equilibrium straight away. And teachers do have a big role in that. They notice the changes, and Billy talked about them, as did Dan, those subtle changes that you're not handing in your homework, you're sitting by yourself, you're not sitting with your friends. So starting those conversations.
There is a program which runs through the health service, which is fairly limited in scope, but it's called Getting on Track in Time. And it's specifically for that social skills and emotion regulation techniques for primary age kids. And it also has an extension to helping teachers recognise and respond to sort of that early signs of mental health issues. So that there is sort of funding coming through just for that exact thing, because they're recognising that getting back to lockdown, social anxiety is increased. They don't know how to relate to people anymore, and there's greater school withdrawal and refusal as a consequence. So yeah, so there is that sort of view that where treatment is going to and where the services are getting funded for, but it's at the moment it's fairly limited in scope. But I understand it's across New South Wales. I think, I'm not sure about international across Australia, but I think it is only New South Wales, unfortunately.
If you have any info on that, Billy, are you able to share that with me so I can then send that on in our follow-up email?
Yeah, definitely.
Wonderful, thank you. So I wonder, I'm just wary of the time now. I knew the time would fly by today. We haven't done any of the polls that we were going to do. I just feel like things have been tracking along quite nicely. But I wondered if we can just quickly touch on therapy. So if somebody is struggling and they go to their GP, they're able to seek help, what kind of resources or what kind of therapies might people be directed towards, and how will that help them? Anyone happy to take that? So it's not all around you go to your GP, you get put on medication and you get sent on your way. There is a process that's followed, and there are alternative therapies that people can look at to help them. I understand.
Yeah, so do you just want to repeat that exact part of that first part of that question? Sorry, Kate.
So when somebody does decide, acknowledges, okay, I need some help, they go to their GP. I guess I'm trying to say that medication is not always the sole answer, or probably very rarely, I would imagine. What other therapies are there available that they might be directed to help them gain more control over their mental health?
Well, yeah, obviously it's really hard to answer specifically because every sort of mental health struggle is different. Every person is different. And look, part of it, look, going to seek professional support doesn't necessarily mean you're going to be diagnosed with anything. I think that's part of the stigma as well, where you can seek that support through your GP and go speak to a psychologist or a counsellor or a clinical psychologist and work through the different therapies like interpersonal therapy, or it's talk therapy or cognitive behavioral therapy, reframing your thoughts and the way you perceive things. So there's definitely that process there around those different elements. But look, for some individuals, they may have sought support 10 years ago or 15 years ago and got a diagnosis and that plan didn't work. We've come such a long way in obviously diagnosis, in medication. So it might just be a reassessment through a psychiatrist or a mental health GP or whatever that may be. So the journey maybe 10 years ago has very much changed. So it's about having faith back in the system as well. I know we hear of the bad experiences, but judging it on your own merits. And I got told something because the first support I went to, I did not connect. I didn't feel comfortable with. And I went home to my partner and my mum and said, I'm never going back there. I'm not listening. They don't understand where I come from, what I've been through. And my mum said something to me I'll never forget. She said, go and get a second opinion. And we're so quick to do that in the physical space, but in the mental health space, we taint every single person with the same brush. But at the end of the day, there's good counsellors, there's not so good ones, psychologists, but there's also different strokes for different folks where what works for one doesn't work for another. So I think sometimes, unfortunately, it is a little bit of trial and error. It does, you have to get an opinion. And I know that's hard and it can be triggering. I really do know that. But what's the alternative? We don't do it and suffer in silence. I've been there as well. So yeah, I think the part of it is it's trying to find the process that does work for you. But the GP is kind of the gatekeeper that can really help with that.
So hopefully that's answered Josh's question as well. He said, how do you know if your GP is giving people the right treatment? And I guess it's that if you're not sure, if you don't connect with the person that you've been put in contact with, go and get a second opinion. Would anyone like to add anything to that?
Again, look, just to reiterate, it's really important to connect. I've noticed in the chat too, people are talking about, there's some questions around, trying to make someone aware that they have a mental health issue, and you can't make people aware. But you can have honest conversations. Now, an honest conversation with your family member doesn't mean a brutal conversation, an aggressive confrontation. But, with my girls and my family, I'm pretty honest. And I say, you're not yourself at the moment. Oh, you don't know what you're talking about, Mum, or I'm fine. I go, well, from my perspective as your mum, this is what I'm seeing. If I can't be honest with you, I'm not sure who can. I'm not judging you, but I'm just saying I've noticed a change. Planting those seeds, getting people to listen, but having those non-brutal, non-aggressive, but honest conversations with people around you. And I always say, and it absolutely, when I have these conversations, it comes from a place of caring. It absolutely comes from a place of caring, and people will see that if it comes from a place of caring.
Well, I want to add to that, I know we're conscious of time, but I have conversations with people that we support, or the education stuff we do, or the training, where they say, oh, I've got a family member, they need to admit they've got a problem. And I'm like, whoa, hold on, let's just back it up a little bit. Let's look at what we're saying here. Like, someone going through a mental health struggle, they've done nothing wrong. They don't have to admit anything. The word is acknowledge, or have the self-awareness where, as their support, it's not about you telling them what they've done wrong or what they're not doing or what they should be doing. It's exactly, you identify changes in what they're like. And as you said, a change is worth a check-in. And the best way to check in with someone is to build rapport, is to build connection. What you say is not necessarily going to do anything, but it's how you make them feel, which is going to be the big thing, which is really, really important.
Thanks, Dan. And some lovely comments there. I see anyone, before we finish up, just go and have a look through the chat. There's some really lovely comments, and thanks to all of our panelists as well from our audience, who I think would have gained a lot from dialing in today. I wonder whether we could just leave the webinar, just a sentence or two from each of you on your suggestions on how to, things are beginning to open up now. If you're struggling, or if you know someone that is struggling, can you just give us a key takeaway for how to best approach the the return to, I don't want to say normal because it sounds awful, but the return to work and play and all those things that we did before the pandemic. Do you have any tips or anything that you'd like to leave our audience with?
Yeah, I'll lead us off. I think one thing, an inspirational thing that has come out of COVID is we realize how much people need people. So that's probably point one. Point two is I kind of, like I've still been speaking to my psychologist every sort of 2 to 3 weeks. And what we speak about is it's called compartmentalization, where we don't have to take on all this at once. And the old African proverb is you can't eat an elephant in one bite, but you can eat in hundreds of smaller bites. So it's about maybe chunking some things down, maybe putting some things on the shelf that you can come back to, and just taking on and focusing on what you can at that point in time to not overwhelm yourself. I was on a webinar the other day, and a lady was just going through sort of ways in which they're coping with the transition. And she said, well, I experience a little bit of anxiety. I overthink things, I procrastinate, and I know that it's this big when it's only this big. So she said, what I do is I just metaphorically cut it in half. And it's like, okay, wow. So I think though just chunking it down and in those smaller bite-sized pieces and grabbing them off the shelf as you transition back can really make a world of difference, instead of those feelings like you're sort of drowning where, yeah, I'm not sure if that might help.
Yeah, that's helpful. Thanks, Dan.
Sorry, Bill, do you want to go?
No, go for it.
I might add it, and it's around, again, it's acknowledging not all sadness is depression and not all worry is anxiety. Some degree of sadness and fear in our lives is inevitable and necessary. So understanding that having feelings and then seeking support where you can from whoever is around, clinical support or family support, whatever that support is, but acknowledging that our feelings are real and our feelings are there for a reason and to be valued.
Thanks, Lorna.
And I think just maybe an extension of that, Lorna, it's kind of that skill of self-compassion, which is a skill and which isn't always available to us at various points, but is kind of treating yourself like you'd treat a good friend. So if you are having a harder day, it's that learning that skill of self-validation of, okay, what's happening for me? Why is this happening? Is it okay to feel this way? What does my body need right now? So I think it is that process, just checking with yourself like you're checking with a friend, because it's so easy just to criticize ourselves and really beat ourselves on the down. So it is getting that insight into what's happening for me right now and what do I really need.
A great point. Thanks, Billy, and thanks to all of our panelists. We have run out of time. So I just want to thank all of our audience. You've been amazing, really engaged and asking really thoughtful questions. I'm sorry that I haven't been able to get to all of the questions, but thank you so much for sharing your experiences and comments on the chat as well. It's been really great to read through. I will share resources that we've discussed during the webinar, plus some other ones in the follow-up email. So keep an eye out for that. I'll send that along to everybody who's registered, plus a link to see a recording of the webinar. Please feel free to share this with as many people as you think would find it useful. Obviously, we're here because we want to support and help our community. So as many people we can reach as possible, the better. And I just want to go back to what Lorna just said about having those conversations with people. If you notice that somebody isn't being themselves, perhaps in a friendly way, just acknowledge that and give them the opportunity to speak and share if they feel like they want to. So thanks so much to Graham and to Steelers for supporting the delivery of this webinar, to Lorna, to Dan, to Billy. We really appreciate you joining us today. I know you're incredibly busy. So thank you for sharing all your work, and just to know everything that you're doing in this space, whether it's research, help or seminars, webinars, it's making such a difference to our community. So thank you so much for all you do in this space. For those of you, again, who aren't too familiar with IMRI and what we do, I urge you to check out our website. It's imri.org.au. There's lots of valuable information on there about the research that's happening in the mental health space, but also across a broad area of disease and treatment areas. And we also have a newsletter that we send out every other month that talks about some of the research, some of the success that we've had, and also some of the events that we've got going on, which, fingers crossed, will be back in action in the new year. We're hoping to have an open day and invite our community into IMRI to see the facilities and the amazing research that happens there. So keep an eye out for that. You can subscribe to that newsletter on our website as well. In November, we're holding a webinar, our last one of the year, on diabetes and cardiovascular health. So prevention, symptoms and treatment, and of course where you can get support. So keep an eye out for details on that. And finally, we will have a survey that will pop up on your screens at the end of the webinar. If you do have 2 minutes, it's just four little questions. If you do have time, we really want to hear from you so that when we continue these webinars, we're putting forward information and topic areas that you find interesting and that are relevant for you. So please let us know what you think. So once again, thank you so much to everybody involved today. We really appreciate you all dialing in, and hopefully we'll see you at the next webinar, and all the best to everybody. Bye.
Thank you.
Stay safe.
Thanks, everyone.
Thank you.
Bye.
Bye, everyone.